Why is MDS difficult to treat?
MDS is particularly difficult to treat mainly because only way to cure MDS is a bone marrow transplant from someone else. So that process is basically wiping out all your bone marrow and blood cells and replacing it with someone else's bone marrow and blood. And as you can imagine, that process is pretty intense and difficult to tolerate. So you have to be pretty fit, you have to be relatively young, usually less than 60, 70 years of age. But the issue is MDS is a disease of the elderly. So most people are over 60, 70 years of age, and as people age, they tend to have more comorbid problems, comorbid conditions like hypertension, diabetes. So a lot of people may end up not being a suitable candidate for bone marrow transplant. So that's the only way to cure. So if you cannot cure MDS, then you go for the next best option, which is chemotherapy. If someone has low-risk MDS, you give them supportive agents only. Without chemotherapy, we give them some agents to boost up their anemia, to make them feel better. But even then, even the chemotherapy is not very effective compared to other cancers, such as acute leukemia. It can be even less responsive to chemotherapy compared to leukemia partially because MDS is rather slow growing. So at the same time, they take in less chemotherapy. So the response rate is not as great compared to other chemotherapy. There are many clinical trials to improve upon them. So we'll see if other therapies get approved. But so far, it is not an easy disease to treat.